Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning, good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to have a little mix of things. We're going to be talking to someone about her business and how she has made it so successful. But we're also going to be talking about personal health. We're going to be talking about personal health for women. Now, men, don't leave. Don't turn us off. You have women in your lives, and so you need to be paying attention to this too. And as I said, we're going to be talking to this delightful woman about how she has been so successful in her career and in her life. And so it's always good information for anyone to hear. So please join me in welcoming Dr. Terry Dunn to our program today. Welcome, Dr. Dunn.
Hi. Waving.
I know. This is so much fun. So let me tell people a little bit about you, and then we'll just jump into this because it is going to be an abbreviated program today because you are so busy helping people. So we want to get as much in as possible. And I had extra coffee today. So yeah, we'll get this done. So where'd your bio go? There it is. Dr. Terry Dunn has been practicing medicine for 35 years, specifically urogynecology, with a specialty in pelvic floor disorders and reconstructive surgery. She has annually made a pilgrimage to Africa to care for the women of a local village there. They recently named a surgical room after her. She's built her practice on education, health, and wellness of women through her practice, which thrives on its mission of women taking care of women. So again, Dr. Dunn, welcome to our program.
Well, thank you so much. I am so excited to talk about what I love.
Well, speaking of that, how did you decide that this is your passion in life?
Well, it started, I was probably an old hippie many, many years ago, and there were not many women in OBGYN.
Right.
In my residency, I was the only woman, and there were 5 men.
Mm-hmm.
And nowadays, it's really a field where there's lots of women and very few men. And I loved taking care of women, and I've seen it evolve. And what happened is I worked at our city safety net hospital for many years. Mm-hmm. And then I decided to go into private practice because I did have a passion for urology and gynecology, and it was a developing field. And so when I left the safety net hospital, I thought I've got to give back because my patients there were primarily people of no means, right. Immigrants, indigent patients. And I saw a little piece of paper that said, interested in women's health in Africa. And I thought, I'm going to go. And what happened was that my husband thought I was absolutely crazy. He didn't know if I'd ever come back.
Right.
Or would I get there? And it was way before cell phones and internet, and you had to rent this giant phone to go over there.
Right. And hope it worked.
And I went, and it just spoke to me. And one of the things that I believe in our life is that one person can make a difference. And one of the things that there's a lot of international medical help now. I mean, there's groups that go from hospitals, but I loved the mission of our group because it was not just I could go and do surgery on 20 women and leave. But the idea was, let's go and let's teach the women there how to take care of people.
Right.
Let's teach the doctors our set of skills. And and that's why we go to the same place. And over the years, with help from we got a PEPFAR grant, with help from donors, with help from the medical volunteers, we built a hospital. We have operating room suites. We have doctors and nurses and community people who work for us. So I believe that's why it's been so successful, because we don't go and tell the people what they need. We teach them, and we learn so much, and we help these people, but we also, when we're gone, have taught the nurses, how do you take care of this post-operative patient? Or the surgeons, how do you do this kind of surgery when we're not there?
Right. Yeah, because they're there all the time, obviously. You know, and I love that you work with them rather than just, here's what you should be doing. You know, because they obviously, their resources are not just limited, they're just very different. And so, you know, you have to work with what they have.
That's right. And you have to learn to be culturally sensitive. You know, one of the things that they started, and I started going a long time ago, and there was a very, very high incidence of AIDS. And it has gone down significantly thanks to the Gates Foundation.
Wow.
Because they have done a lot. And they set up clinics everywhere and they put them in these kind of purple tin corrugated buildings called VCT, which was voluntary counseling and testing, where you could come in and get a rapid HIV test and get treated. But, you know, there were so many myths about HIV then. Right. And I've seen it evolve, that the incidence of HIV has gone down.
Right. Just worldwide.
And it's because of education and early treatment and the advancement in technology.
Right. You know, and that is one of the cool things about the medical field, is it is always advancing. I mean, you know, something that 5 years ago was truly a death sentence, now it's like, okay, this is manageable. You know, and so that is what is so good. And what I love is that you're taking that to an area, you know, in Africa that normally wouldn't have that information at all.
That's right. And what I feel like it does, because, you know, I'm in solo practice, and, you know, because I'm in solo practice, when I'm gone, you know, my patients really don't have anyone, but they're all kind of with me on this, you know, and of course now with technology, they can always reach me, but they love it too. Now, I have to get in for my visit. When are you going to Africa?
Right.
And so even though I'm gone and, you know, financially, I always say, you know, it's my own little donut shop. When it's closed, it's closed.
Yep. Nobody's there making the donuts.
So, but my patients are so understanding and supportive. And I feel like, because they know that I care about women's health, I feel like it enhances my relationship with my patients here, because we're all in this together, you know. We and women have to learn to advocate for their own health. I always, you know, as we were talking before the show, I always laugh, because sometimes patients will come in and tell me about a bad situation with the doctor they had, and or that they didn't care for their doctor. And the thing I always say is that, aren't we crazy? We're more picky about what grocery store we go to than what doctor we choose. It's okay to be picky about what doctor you choose.
Definitely. You know, and we, you know, we have to be our best advocates. You know, we're our only advocates when it comes down to it. And, you know, and it doesn't matter if it's something catastrophic or your annual visit. I mean, you know, if you're not liking what's happening, if you don't feel like you can ask questions, all these various things, I've shared with my listeners and viewers before that I have ongoing health issues, and I love it. On one of the doors of my doctor that I see every 3 weeks, there's signs on every door. If we did not answer your question, you do not leave. And I go in and most of the time everything's going well, but if something is more serious, I've written it down. So that way I don't forget. And I tell people, when you go to the doctor and you've got a cold or the flu or something fairly minor, you get home and you go, when did they say to take this medicine? And when you have a serious diagnosis, your brain shuts off.
Right.
So you have to write it down. All of these various things, and more importantly, take somebody with you. Years ago, I used to work with a doctor who always wanted someone to come with that person. Now they do it sometimes for a liability, but but there are also doctors who no, they don't want anybody else in there. And I've told people, take a tape recorder, or now you have your phone, and record it. And if the doctor doesn't like that, that's not a good sign.
That's a good, exactly. I always say bring someone else, because I'm giving you a lot, especially like at my preoperative visits.
Yes.
I'm giving you so much information. I was a Girl Scout. I want to be sure you understand what's going to happen preoperatively, what's going to happen in the hospital, what's going to happen postoperatively. I give out, things that'll happen to your emotions, things that'll happen to your bowels, things that'll happen to your head. But it's a lot. And if someone's there with you, they can be your set of ears,
right?
Because you're nervous and you're scared. And I think the other thing that I encourage all of my patients to understand and is, if you think something's not right, bring it up,
right?
Because especially in the field I have of urogynecology, what people think is that some of their problems are just because they're aging.
Right. Everybody.
Everybody leaks urine. No.
Right.
No, you don't have to live like that. And so ask your primary doctor about it.
Right.
Look up urogynecology, because it's a wonderful, wonderful field. It is the best of both worlds.
Right.
And it's very important to be your own advocate. And Hippocrates a long time ago said, if you listen to your patients, they will give you the diagnosis.
Right.
And we have a lot of technology that helps us now, but if you listen, you will know you'll be able to figure out what's going on with your patient.
Yeah, because a good doctor reads body language, reads tone of voice. I always love it. The first question, how are you doing today? Fine. I mean, I'm one of those people, and I have stopped doing that. That's just, you see anybody, how you doing today? Fine. Doesn't matter if they're the person in the grocery store or your doctor or whoever, your first response is fine. Well, in most cases, you wouldn't be at the doctor if you were fine. So stop saying that. Exactly. But a good doctor reads the tone of voice. How did they say fine? All those various things. And so, I've learned that I really, now if I really am fine, I tell them I'm fine. But, but yeah, it's picking up on those things that is so important. And I think that's a skill that we don't see people, whether they're doctors, whether they're, somebody who's in business, we don't pay attention to someone's body language. And that's one of the most important things that we need to be watching when we're dealing with someone.
Yes. And medicine is a interactive field. And if you're not interacting and you aren't sensitive to that, then you lose your ability to communicate to the patient what they need. And when I started my practice and I left the safety net hospital, Denver Health, I was very nervous about oh my gosh, how am I going to do my practice?
Mhm.
And I spoke to one of the doctors who had come to Denver Health, and he said, he gave me some really good advice. He said, don't worry about the business of it.
Mhm.
Just do a good job
Right.
and you will have a busy practice.
Mhm. Right. And
And
it's that way for any
for
business.
any business,
Mhm.
I feel that those words of wisdom, and I see young people worrying about whatever they're doing, the overhead, the this, the that,
Student loans.
oh my goodness, you know,
Especially in the medical field. Oh, yeah.
how are they doing all this? But if you do a good job,
Mhm.
your practice will
Right.
build and you'll have a great practice.
Right. And it's funny because I've talked with my other guests about that. And if you provide a great product or service, great customer service, then it everything else comes from that, but when you're focused on the money, people know that. I mean, and it really doesn't matter. It kind of comes back to the old adage of, the used car salesman. I'm going to sell you a car. I don't care if it's what you need. I'm just going to sell you a car because I have my quota to make. And so we immediately know that we've got our defensive shields up, all those various things. But when we're truly concerned about the person and their needs, then the money will come.
Exactly. And that is, it's so funny. The patients will come, and I've been a solo practitioner, which is not the trend in medicine
Right.
anymore.
For a variety of reasons.
And, hospitals now own practices, and I kind of feel like a dinosaur, but my patients love it. I mean, I have had patients I've been in private practice for, 13, 14 years, and I absolutely love it. And we go through a lot because I know my patients.
Right.
That's the other thing, that I know them. I know that they'll call me when their husband dies, or they'll call me to tell me about a life event. And even though I'm a subspecialist,
Right.
I feel like for women especially, you need to find a doctor that you can identify with, that is your advocate in the healthcare system, and to helps you be a better advocate in the healthcare system.
Right.
And
isn't
then,
concerned about just churning people through. I mean,
absolutely.
we've all been to the doctors who, they're doing this, and you've got 15 minutes. Doesn't matter if you fit in that 15 minutes or not. You've got 15 minutes.
And come back for your other complaint. But I really need to talk to you about this. Well, I always say it's really hard or sad when the subspecialist, am spending more time with the patient than their family doctor. That's craziness.
Yeah.
And so I think there are wonderful doctors. You just have to find them. And women especially, I believe that we tend to be a little more accommodating and just say, okay,
they're busy.
Yeah, right. And just kind of take what they're going to give us.
Right.
And, I think that the other thing that has happened by my going to Africa, I think that it has really given me a perspective of really how lucky we are.
Right.
Of really how lucky we are. We have cervical cancer screening, where in Africa, cervical cancer is the number 1 killer of women.
Right.
Well, in our country and in Western countries, it's way down. And it's because we have screening. We can pick it up before it's cervical cancer. And we are so lucky to have the technology, the medicine, the availability, that we have to realize we are lucky, but we still have to utilize it correctly.
Right.
Because if we don't, we can, I see patients that don't get their mammogram. And come on, you guys, you've got it. Your insurance covers it. Please do this for me.
Right.
And we don't realize how lucky we are to have access to all of this health care.
Right. You know, and I think for many people, we do want to be the little ostrich. You know, we're going to bury our heads. If we don't think about it, it's not going to happen. You know, or we feel healthy. You know, I feel healthy. How, you know, why, you know, and all these various things. And, you know, and I think men are, you know, especially guilty of the, you know, we're not going to talk about it type of thing. You know, I'm very fortunate. My husband goes every year I never have to nag him. I mean, he goes every year. He has his annual physical, all of these various things. But men, you know, they don't go. And then, of course, I think we still have this mystique of, but they're a doctor. They know so much. I should never question them. You know, and they're people too, you know, and so it's okay to say, now, wait a minute. I'm just not sure about this. And again, if the doctor isn't wanting to have any part of that, and that's, you know, I was sharing with you before the program, there are doctors through my whole process that I've been through that I have fired, where I have just not clicked. Some of them haven't listened to me. I got the finger from one of them, the moving finger. And he's, you know, and I almost reached out and went, you know, and he told me, don't talk, just listen. Now, of course, hello, that is a little hard for me. I understand. But he went through, he talked probably for 10 minutes, and I just, yeah. But of course I was mad. I'm thinking, doesn't matter what this man says to me, I'm never coming back. But, you know, so he gets through his whole spiel and he says, now what? And I just sat there and he said, what? I said, you told me not to talk. And so then he kind of realized, okay, he'd overstepped. And I said, what you just spent 10 minutes explaining to me does not pertain in the slightest. And I said, first of all, you should have looked at my chart before you came in, which clearly you didn't. Now, granted, if you were to print my chart, it's, you know, War and Peace. Right. But yeah, I mean, he had absolutely no clue why he was even seeing me. And so now he did have the grace to apologize, but I didn't go back to him because I thought, no, especially this, you know, this just, I'm like, no, you know, but it's a complicated process when we're working with anybody who's an expert. You know, what is that give and take, you know, all those things. But I think most importantly, we need to realize they want to do their job well, and they can't do it if we're not giving them the right information, the right feedback, all of those various things. You know, if I'm just telling somebody I'm fine and I'm not, then I shouldn't be annoyed when they don't figure it out.
Right. We shouldn't have to guess. And that's where I really think that I think men are very guilty of this. They never go to the doctor. That's right. That's why hospitals and healthcare organizations know that the women tend to make the decisions on healthcare because they'll say, oh, honey, I liked this hospital. You should go there. Or this is, and so because men really, but I think women tend to be more passive about our healthcare.
Yes, they're the expert. They know what's best for us.
And we don't communicate with them, as we don't let them know because we're used to multitasking, covering it up. We may have to go to work that day. We may think it's whatever complaint is just a normal problem of aging. That's what I see a lot of is that, oh, well, I've had babies. This is why I have this problem.
Right. Yes.
Well, I'm old. I'm menopausal. This is why I have that problem. Oh, I'm young, and this is why I have this problem. And it isn't. We should be healthy in all these aspects, and we write it off. And we were talking a little bit. The other thing is, I think as an advisory or giving us advice, Google is great. But one of the things that I always tell my patients is that people who have time to complain many times are on Google writing all the bad things and not writing all the good things. And I say, put this in your life. If you have a good experience, you tend not to go on to the internet or to write something about.
You think, well, that was good, and you go on.
You just go on. You don't feel. But if something made you very angry, you're going to do that. And
Right.
and that's good and bad. I think we all need to be informed. We all have to realize too that 99.9% of doctors are very interested in their patients'
Mhm.
complaints and want to and have more than an algorithm
Mhm.
or an idea that, oh, this is how we treat this.
Mhm.
They can look at you and say, this is how we treat
Mhm.
this, but I'm going to do it a little
Mhm.
differently because you're in this category.
Right. Right.
And I think that's how you be
Mhm.
a good advocate, how you be a good patient, and how
Mhm.
you be a good doctor.
Mhm. Right. And it really is about having communication. I mean, that is what it comes down to is you have to be telling people this works, this didn't work, and Google is, we lovingly refer to it as Dr. Google. But there's probably more bad information out there than good. But no matter what, it's almost an overwhelming amount of information. And when you have a problem, doesn't matter what it is, something minor, something major, if you start reading the information, it very quickly gets to be overwhelming, and all of the differing views and opinions, and then of course you toss in your friends. I have a wonderful, wonderful support group for what I have been going through. And it's been very interesting. I have a private Facebook group where we chat about things,
Right.
and I try and keep it upbeat and things. But people are providing advice. But one of the things that I have found is I have those people who have a product that they could sell me that's going to fix me. Yeah, okay. And and usually I'll at least check it out a bit. I mean, just
Right.
primarily to be polite to them, but it's not going to fix. I mean, I remember years ago when somebody told me that the product that they were selling would cure lupus. Now I have family members who have lupus, and so I was like,
Right.
and I said, I don't think so.
Right.
And they went, why not? I said, because and this was years ago, but they still don't know exactly what causes lupus. But my understanding is it's genetic. It's a DNA thing. I
Right.
mean, this isn't you take a pill and it's all better. And so I told this person, you're not going to rewrite someone's DNA code with your product. And of course they were just incensed that I questioned them. But, but you have the helpful people, and you have the people who are helpful who want to sell you things. And then you have the people who are just negative, and
Right.
and so and Facebook and social media makes that worse because of course it's expanded. But it's just like 100 years ago, you went to church and you told your little group about what was
Right.
going on with you, or your book club or whatever. We've just given so many more resources that people can just totally be confused by things.
And it's too much, and you get too much
Right.
information, and you don't know how to verify
Mhm.
it. You
Right.
don't know how
Mhm.
to, and you don't know how to weigh it.
Mhm.
I think that is I think that's become a challenge
Mhm.
for physicians,
Mhm. Right.
because the other thing that's really changed
Mhm.
in medicine
Mhm.
is some of the direct to patient marketing.
Right. Oh
Y-
yeah. Mhm.
well, Dr. Dunn, I saw this ad for this drug. Yes, but you don't have that problem.
Right.
This
Yeah.
isn't going to
Or you
help.
have that and this, or
This
mhm.
is not going to help.
Right.
But they have, and I think that that's not bad because doctors
Mhm.
can't keep up with every
Right.
single drug.
Mhm.
So it's good,
Mhm.
but it also, the people who are marketing to the patients are selling you something.
Right. Right.
They are not really interested in
Mhm.
your health care.
Mhm.
They are marketing to you
Mhm.
because they're marketing,
Right.
just like
Mhm.
a store
Mhm.
markets their
Right.
product,
Mhm.
and their product happens to be a medication.
Mhm. Right.
Or
And it doesn't matter if it's something fairly minor, like a heat patch for muscle, problems.
right,
Okay, that you might not have a muscle problem. So, you could be actually making things worse.
right.
Or obviously, the commercials that advertise that for very serious illnesses.
That always
Mhm,
floors me.
mhm.
I don't
Yeah.
understand that. I could not ever understand why they market those drugs,
Mhm,
because if you go to an oncologist
mhm,
or a urogynecologist or a
mhm,
nephrologist and you have a serious problem, because a patient says to me, I saw this drug on TV, well, that might not be the regimen.
Right. Right.
I don't understand where companies believe that marketing is going to affect their outcome.
Right. Yeah. Even with something like aspirin, there's
Correct.
different dosages. There's all sorts of
Right.
different things that are in there, and then you enlarge that to pain relief. And oh my gosh, then it's just, and so that's where, like we said, it can get overwhelming. And so why not ask that trusted expert who's going to say, okay, no. Here's what you need, or let's at least try this. I love my doctors who say, let's try this. Sometimes it works, sometimes it doesn't. But that's what's key about it, is they know this is what we need to try first. This option was great, but probably not for you.
Well, and I think that is the very important thing that has changed in medicine, I believe, a lot, but not with all doctors.
Right.
I believe in the collaborative approach, that I will say to my patients, we've got A to offer, B to offer, and I don't want you to think you're an experiment, but you are an experiment.
Right, because every person is different.
How that's going to work. We're going to try this, and this is why it should work. And then if it doesn't work, then we're going to try this.
Right.
But really, medicine still is a trial and error. And yes, we know in 85% of patients, this drug works for overactive bladder, but you may be that 15%.
Oh yeah. And I've obviously found out with everything I've been going through, there have been things where they're like, we don't know why you reacted this way. Whether it's something little, I have an allergy to surgical glue. That's not a good thing to have an allergy to. And of course, the only way you find that out is you have surgery, and it's like, ow, this is worse. But yeah, it's trial and error. And then it comes back to the communication. I'm really good about telling my doctor anything else I might be taking, but this is the day and age of additives and all of those various things. And one of the things that I asked my oncologist about not long ago was a CBD lotion. My feet bother me a lot. And that is actually one of the side effects of my medicine.
Yes, it is.
And so I asked her, I said, is it okay? And she said, yes. She said, go ahead. And as long as, it's not mixed up by somebody on the corner, she said, it's okay for you to go ahead and use that. But I thought, I want to make sure that having CBD doesn't cause a problem with something else. Now, taking CBD would be totally different.
Right.
And fortunately I've never had to do anything like that. But yeah, I'm like, no, let's just double check on all of these things. But we don't stop to think, what are the vitamins we're taking? What are the supplements we're taking? And can that cause a problem with something else?
Well, and you had mentioned something when we were talking that I ask all my patients to do. Write down everything that you are taking. Keep it on, make it on a little card, put it on your phone. I'll take a picture of it, because people do forget. Because I've had an example of this is one of the newer herbal things that people like to take is turmeric.
Yep. Oh yeah, that's one of the things that they've talked to me about.
Turmeric is great. However, turmeric acts like a blood thinner. And so if you're getting ready to go into surgery and you don't tell your doctor you're on turmeric, you might bleed more.
Right.
And so I say, please write it all down, and then write down anything that you need to find out that you're thinking, because I may think we're done with the visit, and you might look and say, you know what? I forgot to ask you this. And then it's so much better to be in the room rather than as you're walking the patient out and you're in the hallway talking about something very personal. Write it down, bring someone with you, and be picky about your doctor. You get to do that. You get to do that. We don't, and again, think how picky you are about your gas, your groceries, where you eat dinner. If you don't get good service at a restaurant, you don't go back.
Right.
Why do we say, well, this doctor makes me wait, or they don't, or maybe they make me wait, I understand, but they don't listen. They don't listen.
Right.
And
and it's funny, we might think, well, we have to go to the close doctor, but I'll drive 45 minutes for dinner.
Exactly. So I think that those are things of, again, I think that business and medicine is kind of an oxymoron, but it has to be together. But if you find a good doctor, stick with them. That's the other thing.
Right. Oh, yes.
Stick with them. Argue with your insurance company. If you find someone you like, because, and again, I feel like we women aren't as good as advocating for ourselves. We're good for advocating for other people.
Oh, I know.
We're really good at that, but we're not as good as doing it for ourselves.
We don't want to be a bother. And I mean, how many times have patients told you, well, I don't want to bother you, but and that's when it's like, yes, that's what it's, and it's not only what you're paid for, it is what you're to be doing. It comes back to that service, that support.
Well, and I believe I am one of the generation that medicine was a calling. It was not, and I'm not saying that doctors now don't think that. It's just a little bit different. There's so much more technology, and there's so much more, but it's a profession. It's not just like going and getting your hair done.
Right.
It's something that you are dedicated to, and if you do that, you'll find the right doctor. And I feel like I've been very lucky, and that's why my practice has been very successful.
Right.
So,
well, because word of mouth is obviously very important to you, and that's where women excel. They're going to say, well, you have that happening. Here's who you need to see.
Exactly.
Yeah,
Talk about what's going on. Exactly.
And women are going to tell each other, oh my gosh, I pee when I sneeze. And somebody's like, here's who you need to go see.
And that's not normal. It's not just because you had a baby.
Right.
You're not supposed to do that.
No. It's part of why we wanted to talk about this, now, is that March is National Women's Health Month, and March 8th is International Women's Day. And so tell us briefly, because we're almost done with the program, why is this so important to you that and granted, I'm one of these, okay, it should always be women's internationally, all these various things, but why do what's so important about focusing on it now?
Well, I think having a Women's Health Month and Day is so important because we don't take time out of our busy schedules to say, what about our health?
Right.
And whether we are women who live in Denver, Colorado, or whether we're women who live in Siaya District in Kenya, Africa, we all have the same bodies. We all have the same health issues. And our health issues are unique.
Right.
We have breasts, and yes, men can get breast cancer, but we women have that. We have cervices. We can do things to help ourselves prevent our illnesses. We can take charge and control of what happens to our body. And we think of the big issues, but it's little issues. It's all those things. What do you do every day? How do you eat? Do you exercise? What do you do for your mental health? How do you keep yourself together when you're pulled as a mother, a grandmother, or an employee, a wife, a friend? How do you take a little niche for yourself? And then what makes us all together and different from any other species in the world is that we think and we do better if we are joined together.
Right.
And I think that applies to our health, our politics, our world.
Mhm.
We can think and empathize,
Mhm.
and we we all feel better if we're feeling good and are able to give something to someone else.
Right. I
And
love it.
that that's kind of my philosophy.
I
So
love it. I love it. Well, Dr. Dunn, I know you are so busy, and so we're going to go ahead and wrap up. For information about your practice, the website is, and I'm going to spell this, folks,
yeah, 'cause it's weird.
urogyns.com. And that's urogyns.com. Obviously, you know, patients need to be in the Denver area to be able to see you, but you've got some great resources, great information about your pilgrimage to Africa. You know, all of those various things are on your website. So I strongly encourage people to go there and just find out more about you, because I think you're just fascinating. And this has been so much fun. I may just have to schedule an appointment the next time
Just
I'm in
come.
Denver.
We have patients come from all over. You know, we get patients from little towns all over Nebraska.
Right.
And Denver's a great place.
Mhm.
So come and have a visit in Denver.
I know. Well, and we're back there several times a year. We still have our
Right.
University of Colorado football tickets, and you know, and so we have to come back, and family, all those various things. But again, it's urogyns.com.
Right.
I've been having a wonderful time talking with Dr. Terry Dunn. I'm Deb Creer. And until next time, everyone have a great day.
Great. Thank you.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.